knock, knock, knock. Wash hands, provide privacy. Hi, I'm your nurse Kira for today. What's your name and date of birth?
Caitlin, born yesterday, 10/21/2002.
And if I could check your armband. Okay. I have verified orders to come in and do your vital signs, cardiac, and respiratory assessments today. So I'll be starting with your vital signs. If I could start with your blood pressure.
Okay.
Is that too tight?
No, it's not.
Okay, I got 110/70. And sorry, I forgot to ask this before, but what's your normal blood pressure?
It's 110/70.
Okay. Okay, now I will be taking your pulse. Okay, I got 30 for 30 seconds, so that would be 60 for the full minute. And if you could put your hand right here, and so I could check your respirations. Okay, I got 8 for 30 seconds, so that would be 16 for the full minute. And are you having any pain today?
Yes, I am.
Where's your pain at?
In my knee.
Is it sharp or dull pain?
It's sharp.
And when did this last start, or when did it start?
2 days ago.
And for your pain scale, are 0 being no pain at all, 10 being the worst pain you can have, what is your pain?
About a 5.
Okay, and what makes that pain worse?
When I ice it.
Okay, I'll take note of that and we'll move on to your respiratory. Okay, so are you having any shortness of breath?
No, I'm not.
And do you have a cough?
No.
Okay, today I will be monitoring your rate, depth, and pattern. I will be watching for respiration above your upper chest just to make sure it's normal for a couple seconds, and then I will start on your actual. Okay, it looks normal, and then I would document it for 30 seconds, which it is not labored, not shallow, so it looks regular, and which is considered eupnea. Now I proceed to auscultate your lung sounds. Okay, and if I could have you put your left arm on your right shoulder and turn towards me. And I'll do the middle one. Okay, if you could do the opposite now. Okay, now we'll be doing your back. Okay, looks all good. Now I don't have this on hand, so we will just do it with a bottle here today. But I'll be simulating the inceptive spirometer. If you could hold this for 2 to 5 seconds and do it 10 times per hour. And if you could just take a deep breath and demonstrate it for me. Okay, it looks good. Okay, now we are going to be doing your cardiac, and if I could, do you have any chest pain?
No, I do not.
And could I have you scoot down or scoot up in the seat a little bit so I could get you at a 45-degree angle? Okay, and now I will be checking your jugular just to assess if you have any heart failure. Make sure it's not swollen or anything. And it looks good. So now we'll be moving on to your first intercostal space, which is your aortic area. Okay, now we'll move on to the second one, which is your pulmonic. Okay, your third, which is your Erb's point. Okay, your fourth, which is your tricuspid. And now your mitral valve, which I will be checking also for your heart rate for a full minute. Okay, your heart rate for a full minute was 72.
Okay.
Okay, and now I will be moving on. Oh wait, could I check your skin and make sure you don't have edema and make sure everything's okay? Okay, looks good. And if I could check your leg now for edema. Okay, looks good. Now we'll be, normally I would have her take her shoe off, but I'll check the dorsal pedis for a pulse. Then I will move to the inside and check her ankle pocket for a pulse. And make sure on the other foot, which it would be, make sure it's bilaterally the same, which would be 2 plus normal. Then I would go to, if she didn't have a pulse on her foot, I would check the back of her knee, which is the popliteal. Now I'll check her femoral pulse. All good. Now I'll check her radial again. And then I will check her brachial. And it all looks good. And then now I will document those findings with everything I did today and wash hands again and then leave.